I'm coming in with right lower back issues. I've heard of maybe my lumbar, my SI, I have no idea. But it's just chronic for about 1.5 years now. That now affects my right shoulder, affects the way I stand. I can't sit for too long without it aggravating. I've cracked my back every day. There's not a day that goes by where I'm just not twisting and turning and trying to just alleviate it. And it's gone so, I've seen PTs, I've spent a lot of money on PTs, and the progress has been minute. Anytime I go into shoulder flexion or I'm pressing or I'm pushing away from the ground, I feel a click on between my scap and my ribs. If I press a kettlebell, it's a very heavy kettlebell, the next day my physical shoulder will hurt. Anytime I do pull-ups, that's just, again, that's an overhead flexion position. That's just not a comfortable position to be in. And it's painful. Like the next day I'm just like always like, man. I have torn my labrum in both shoulders, so I am dealing with just pain my whole life. But any type of rotation or IR, it's not comfortable.
So right now we're checking for if there's any abnormal temperature. In essence, we're looking for signs of inflammation. Inflammation gives off heat. We're not too concerned about the muscle heat, but we're concerned about, is there any damaged structures that initiate the inflammatory process, and we have one right at this level here. We're scanning for other areas. Everything is gone away except right there. Any tenderness here?
No.
Not really. What about here?
A little bit.
A little bit. So that's a sacroiliac joint. So let's check. Okay, so we got a little freebie there. So when we hear noises like that during assessment, that tells us there's something that's very unstable. Tender right there, huh?
Yep.
That's that fifth lumbar right there. So it went again. So that tells us this is very unstable. And I'm not surprised about that because we also have signs of inflammation here. All the pooling of edema and fluid over here, trying to protect here. All these muscles are guarding at this particular level here as well. We're going to check all the other levels. Everything else is moving just fine. That's normal. Abnormal is when it's stuck. And we got one right here. Now, considering that chiropractic is about the nervous system, this particular level also innervates the stomach. So the other question is, have you noticed any problems with your digestion when you eat or drink foods, cup of coffee, what have you?
Cup of coffee, yes.
Yeah. So what's going on when you drink the coffee?
I do get heartburn.
So there we go. Right, so that's a possible potential. So on the future visit, you'll let us know how it is when you drink the coffee. Right? I want to see these in proper alignment. In essence, normal, your lumbar spine is like this. It's supposed to move like this amount. In your case, there's slight little misalignment. You just saw right there. See how much more it moves? Yeah. It doesn't take much. We're talking about like 1 to 2 millimeters misalignment. It causes a significant amount of instability. That's why you feel it, crack, 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 keeps on moving all around, and also things just seize up. Why things you felt like when you got off the train and you felt like you had to lock up in place? Because since this over here, right, and she will attest as well, this is nucleus pulposus, this acts like a ball bearing. This is what allows us to pivot all directions. So since it became compromised and then there's too much movement, right, your body says, well, what the heck's going on here? It's no different like you're leaning back on a chair and you're ready to topple over. We don't want to do that. So the only thing that's preventing you from toppling over, your erector spinae muscles, the postural muscles, they clench up. So that's why you felt like, whoa, what the heck? I'm really tight, right? That's the story. So this one over here, all of this just only 2 millimeters, it just went backwards. That's enough to get you in trouble. That's the one we need to correct. And the next one we're looking for one you over here is this 6th dorsal over here. All right, champ, drop it, give me 50. So we already see over here, all these muscles here, they're not engaging as well in relation to the left.
I have a lot more feeling. It feels like the space that would be the top of my pelvic bone. Just I feel a lot more awareness. Kind of just a feeling would be the best way to put it. Ooh. Oh, can move. Man, my head feels a lot clearer. Wow, I don't even know how to put in words right now.
Well, I'll tell you what.
Yeah, let's
do a couple more push-ups here.
Okay.
Well, I like that.
I feel a lot more awareness here now.
Yeah, your muscles are engaging here a lot more efficiently now.
Wow. Okay.
See how not both of them are gliding?
Yeah,
equal?
not much of a click. Not much it's like a clicking or scraping feeling.
Because we want both of these scapulas, the shoulder blades, to move a similar amount. We want symmetry, and they're doing that. We see the rhomboids are working just fine, the traps are working just fine, these lats, they're engaging just fine. All your muscles there, they're engaging just fine.
Yeah, that feels good. No pain on the right shoulder or the right shoulder blade. So I walked into the office with my girlfriend and we go to sit down in the very large, very nice waiting room. And I see this. And in September I had done a photo shoot with Men's Health for a kettlebell segment, which is what I specialize in, if you want to call it. Anyways, here I am on page 19, swinging a bell, a little fun photo shoot we did. And then on the next 2 pages, I was just promoting this animal flow bodyweight kettlebell stuff. And so sure enough, for jokes and giggles, I just signed it and brought it in to show Dr. Suh, and here we are.
Well, thank you for dropping by.
Appreciate it, Doc.
Oh, you're very welcome.
Thank you for having me.
Oh, you're very welcome.